होना चाहिए हर दिन होना चाहिए नारी के नाम, बिना रुके करती है वो हर काम। हर दिन होना चाहिए नारी के नाम, बिना रुके करती है वो हर काम। उनके लिए ना करो समर्पित सिर्फ एक दिन, नारी को करो नमन प्रतिदिन। So with this, good morning. Today's my topic is Rajswala Paricharya. Rajswala Paricharya means holistic code of conduct of menstruating women. So what do I mean by Rajaswala Parichaya? Rajaswala means menstruating woman. According to Acharya Dalhan, it means Shodhana Prakriya. Shodhana Prakriya means natural occurring a monthly biological detoxification process in the form of menstrual flow. It also means Vranit, which means wounded woman, which means woman's injured state of the reproductive tract. Basically, Rajaswara Parichaya means natural fluctuation in dosha and dhatu in which Vayu is in the predominant state. So as you can see in this diagram, first 5 days of the woman are for menstruating, then it's follicular phase, and then it's ovulation, and then it's luteal phase. So what we are going to talk about is about first 5 menstruating days of women. First, let's start by Mitahar. Mitahar means what you should consume in her diet. So basically, whenever the woman is in menstruating condition, she should eat nutritious and desirable food. She should consume food like milk and yogurt, which are rich in calcium and lactobacillus. She should also consume vegetables like spinach, which is rich in fiber and iron, and because of that, it also helps to supply oxygen to the cells, that helps to replenish the blood loss that happens to women during menstruation. You should also eat try to include in your diet whole grain cereals and fruits like orange, which is rich in vitamin C, banana, which is rich in potassium, carrot, which is rich in vitamin A. You should try to fill your stomach up to 1/4 part, and you should also include food with sweet taste and a little cooling effects for good feeling of the body and the mind. Now, what to avoid? So women who are in menstruation should definitely avoid junk food and overeating, as that causes heaviness and dullness in the body and mind. She should also avoid packaged food, as it increases the vata dosha that is in predominant state of women. Women should also avoid rajasic and tamasic food like non-veg, spicy, stale, and oily, as she should definitely avoid salty food, as it creates irritation and heaviness in the body and the mind, and also the pungent foods, as it increases the pitta dosha. Now, let's talk about what are signs of healthy bija. Bija means both sperm and egg. So if you talk about healthy signs, then your menstrual flow, your blood flow should be red in color. It does not really have any odor, and if it is healthy, then it should not leave any blood stains on the cloth after you wash. The color is like that of blood of rabbits, and the quantity is 30 to 50 ml per cycle, and a cycle duration is generally 1 month, and it is also known as Shukra, Shonit, Raja, and Artava. Talking about sperms, sperms are white or milky, and it has a honey odor. It is liquid and sticky, and generally quantity of a good is 3 to 5 ml semen, which contains 60 to 100 million sperms per ejaculation. Generally, it occurs basically in women, it's 1 month, and in sperm, it is 2.5 months. It is also known as Tejas, Bijas, Retas, Virya, and Shukra. Talking about type of menstrual disorders. So first, it's a state where no bleeding occurs, that is amenorrhea. Then there is a state which occurs in which painful bleeding occurs, which is known as dysamenorrhea. Then there is less bleeding, which is known as oligoamenorrhea. Then there is heavily bleeding, which is menorrhea. Then there is uncontrollable uterine bleeding, which is irregular bleeding. Then there is secretion of white discharge, which is leukorrhea. There are also types of sperm disorders if not taken care of. First, there is oligospermia, in which sperms are less than 5 million per ml. Then there is azoospermia, which is there is complete absence of sperm in the semen. Then there is hemospermia, in which sperm contains blood cells. Next, talking about what yoga asanas and pranayams women should do, as in menstrual cycle, a woman should avoid activity that provides strain. First, women can do Vajrasan, which facilitates digestion. Women can do Virasan, which relieves leg pain and back pain of women. They can also opt for Makarasan, which relaxes back and spinal muscle. They can do Kati Vakrasan, which ease the back and abdomen. They can also opt for Pavan Muktasan, which regulates the Vayu dosha. They can also opt for Omkar mantra, as it vibrates the inner consciousness of women. They can also opt for cooling pranayama, as it gives cooling effects and clarity of mind to prepare them for meditation. They can also opt for meditation to preserve their energy, and they can also opt for trata as per their capacity. Okay. So how to, as we have seen, what kind of menstrual disorders and disorders through which men and women go through, it's very necessary to take care of bija. So now, how to improve the quality of bija? First, exercising and practicing yoga can create a very blissful impact on the same. They should avoid smoking, alcohol, and caffeine, as these substances contain some substances, harmful substances, which are very bad for both egg and sperm. They should try to consume foods in their diet which contain antioxidants like vitamin C and E, which can improve their egg and sperm health. They should avoid trans fat, saturated fat, bakery item, maida, refined fat, as due to with the launch of Zomato and Swiggy and with opening of so many junk outlets, they just these days young generation only opt for going out every now and then, but they don't realize what impact they can have on their fertility. They should also intake of fiber, fruits, protein, especially from vegetable sources. And the most important thing that matters is mindset. A strong mindset is very important for even quality bija. If the couple really wish to conceive, they should decide and they should have a strong mindset from a start that yes, we wish to conceive and we wish to manifest a healthy baby, which really helps. Now, what are the things that women should keep in mind? They should keep their body hydrated with lots of food and water. They should rest on hard, but the floor should be comfortable. They should avoid resting on a soft cushion. They should avoid any sexual intercourse. They should avoid activity that give them strains. They should stay in secluded place, but with a moderate room temperature. They can also opt for mild, soothing foot and head massage. Now, how women should take care of menstrual hygiene. Menstrual hygiene, as you can see, is very important, as women can also face urinary tract infection and menstrual disorders. So first, that a woman should always use sanitary napkin, tampons, or cups. They should change pads every 4 to 6 hours. A good wash is very necessary. They should not use any scented products on the vaginal area as that disturbs the pH balance of vagina. They should use clean and comfortable undergarments. They should know how to dispose of sanitary product properly, and they should eat well and nutritious food. Why it is important that this day young women should be aware about menstruation. When young women are aware about menstruation, they can have the access to safe and affordable sanitary materials which can reduce their risk of infection. They can realize what effect they have in future about on their sexual reproductive health, including teen pregnancy, maternal outcomes, fertility. Poor menstrual hygiene can pose serious health risks like UTI and reproductive infection and infertility and birth complication later. This is the reason young women in these days don't have awareness, and that's why they don't take care when they are in menstruation, which I think is one of the reason of infertilities these days. Also, did you know that every year we celebrate Menstrual Hygiene Day on 28th May, which is celebrated to highlight good menstrual hygiene practices during your period and to raise awareness about importance of access to menstrual products, period education, and sanitation facility. Lastly, thank you, especially thank you to ma'am that, I have done a lot of courses, not on this topic, but it's like I've always felt that there is no personal touch, there is no personal connect with the instructor, and they are just doing it for money. But here I have felt that every minute that I have invested and every time it is totally worth it. So thank you, ma'am, for even generating this awareness. So yeah, and it was really fun learning with you. And I hope that this journey continues so that I can disturb you whenever I have a doubt, because uh, and I did not know like P for pregnancy. I just knew, okay, this is pregnancy, this happens. There are so many things, and why it is important. I mean, awareness in our young generation, I think it's very important for the future. जो लोग निकल गए वो तो ठीक है, it's fine, but हमारे लिए जितनी अवेयरनेस होगी हम ज्यादा लोगों को ट्रेन कर पाएंगे. एंड आज हमें मेंस्ट्रुएशन भी कितना इम्पोर्टेंट है ये पता चला. नहीं तो लाइटली लिया जाता था कि ठीक है आ गया चला गया बस चला जाए. पर वो क्यों है, वो क्यों आता है, एक अवेयरनेस मिली, एक बहुत ही इंसाइटफुल वो मिली. सो थैंक यू सो मच मैम, इट वाज ग्रेट लर्निंग विद यू.